good morning, or good afternoon, depending on where you are. So my name is Joe Friedman. I'm an MD PhD student at UCLA, and I'm going to be presenting Tracking Rising Racial and Ethnic Disparities in Overdose Mortality, now casting for real-time inequalities-oriented surveillance. So as I think probably most of us know by this point, overdose deaths have increased exponentially in the United States for the past 4 decades. Here's a graph showing the top 10 countries in the world in terms of per capita overdose death mortality. And we can see that by 2019, before the pandemic made everything worse, the US already had twice the drug overdose mortality of the second highest country. And I think about 20 times, a rate that's about 20 times higher than the global average. So we're clearly a sort of extreme global outlier in this particular public health problem. However, despite the magnitude of this issue, we really don't have very timely data or good data on this topic. So for example, to get any kind of preliminary, like early data about overdose deaths, we have to wait about 7 months. And for the full details on overdose deaths, we have to wait 12 to 24 months. And so when overdoses spiked during the COVID-19 pandemic, this was actually common knowledge among frontline harm reduction organizations. People knew this was happening to their friends, the people they work with, and yet we actually had no kind of data from the CDC for about 8 months after the spike started to happen. And very problematically, data broken down by race and ethnicity and other social factors were delayed by well over a year. And this is especially concerning because prior to the pandemic, we know that overdose mortality was increasing most rapidly among Black and Latinx communities. And so we really need better inequalities-oriented overdose surveillance to sort of understand what's happening in a quicker way. And here's, I think, an example of why this is so important. So this is a headline from, I think, from July of this year, and it's talking about, it's in the New York Times, right? It's very high profile articles talking about how much COVID deaths are increasing. And there've been, hundreds of these very high profile stories about overdose deaths, but because we haven't had access to data broken down by race and ethnicity, if there is a big increase in racial and ethnic disparities in overdose, which I'm about to show you data, showing that there have been this entire time, this is sort of missing from the story, right? So the Biden administration is developing policy as we speak. The policy response is happening, and yet there's this huge kind of vacuum in the data about who are actually the people who are dying from overdose. And I think that's massively consequential for our response. And currently, I think a huge blind spot in the way that the CDC is releasing overdose statistics. So in kind of response to long lags in general, the research team that I'm on, we first put out this piece, overdose-related cardiac arrests observed by emergency medical services during the US COVID-19 epidemic. And this was before there were any provisional data showing the actual overdose death rates during the pandemic. We use something called the National EMS Information System. This is basically a big registry of EMS calls that has about 90% of EMS calls in the US. And it's available on about a 1-week lag, data uploaded once a week. So it's much faster than overdose death statistics. And so we looked and, could we actually detect a shift in overdose deaths using, sort of EMS observed overdose deaths, which might tell us something about the total. And so here you can see on the y-axis, essentially the rate of EMS observed overdose deaths as a rate of all EMS calls. And we can see right when the pandemic, and 2020 is blue, and the other lines are previous years. And we can see right when the pandemic started, there's this huge increase in EMS observed overdose deaths. And so this tells us that actually perhaps the EMS observed deaths are a reliable proxy for all overdose deaths, and they're available on a 1-week lag instead of an 8-month lag. So we put out this article, and then we decided to assess, could we actually do the same thing but broken down by race and ethnicity? So this is the second longer paper that came out. And so here we also did a more formal sort of analysis to look at how well does one thing predict the other. So we showed that EMS observed overdose deaths are actually highly correlated with overdose deaths, total overdose deaths put out 8 months later. And you can see here the EMS observed deaths on the y-axis and total overdose deaths on the x-axis. And there's a fairly tight correlation over time. And we were actually able to predict the total number of deaths for 2020 in this paper. We predicted it would be, I think, 90,000 with a confidence interval up to 95,000, and the true total was released a few months later, and it was 93,000. So we were pretty close. And importantly, the EMS data actually have information on race and ethnicity and all kinds of other social stratifiers that I think are important to keep track of. So we showed that the largest relative increases in overdose mortality in the EMS setting were among Black and African American patients, and also Hispanic and Latinx patients, whereas white patients had lower increases. It still went up, but to a lesser degree. And similarly, neighborhoods that were more impoverished also had the biggest increase. So now, finally, after I think far too long, the CDC has just released some new provisional data for 2020, broken down by, it's quarterly, it's not monthly, but it is broken down by race and ethnicity. And so here you can see this quarterly but annualized death rates per 100,000 population, separate for 4 racial and ethnic groups. So we have white non-Hispanic individuals here in red, American Indian or Alaskan Native non-Hispanic individuals, Black or African American non-Hispanic individuals, and then Latinx here on the bottom. And so we can see that actually in 2020, the Black overdose mortality rate overtook that of white individuals for the first time since 1999. And we can see that by far the highest overdose death rates are occurring in American Indian or Alaskan Native communities. So I think what we're really seeing here is that it's pretty clear that pandemic-related spikes disproportionately affected Black and Native communities, and the Black-white ratio by the last quarter of 2020 rose to 1.19, so about a 20% disparity, and the Native-white ratio rose to 1.34. And importantly, like, these data are still 11 months old and counting, right? And I say and counting because we just got these data, and we probably, if the CDC continues to release data the way they have, we won't get any new data for a year. So these data, you know, let's see, we can see a visualization here. So this is where we are in time, this line, and then this is where the pandemic started, and this is the end of the data we have. So you can see they're already about 10 months old, and potentially they'll get to be, you know, like 20 months old before we get any new data. So this is where the nowcasting piece comes in, and I think hopefully has some value. So here we're looking, this is sort of similar to the other graphs that I showed with broken down by race and ethnicity. We're seeing EMS observed overdose mortality on the y-axis and total overdose mortality on the x-axis. And you can see that there is a fairly tight correlation within each racial or ethnic group. There's a fairly tight correlation. However, the correlation is actually not as good if you put all of these points on the same graph, and that's because there's actually a pretty different intercept between the different groups. And I think that stems from the fact that there's very different burden of disease based on race and ethnicity in the United States, which I think some of the other talks today have pointed out. And B, people are just not all willing to call 911 to the same degree when someone is having an overdose, right? Because of racism in the criminal justice system and police response. There's a rich literature, especially qualitative literature, about people who just don't want to call the police when someone's overdosing because they simply don't trust in the police, which is extremely understandable given the state of our country. So this is, I think, affecting the intercept between the groups, but I would argue that it's fairly reliable within each group, and that's the hope, and that's the way the model is set up. So essentially, we're using a hierarchical mixed effects regression model to look at these relationships. And we model overdose death rates as a function of slopes on time, the fixed slopes on time and EMS observed deaths, overdose deaths. And then there's random intercepts and slopes by race and ethnicity on time and EMS observed overdose deaths. And that allows kind of each of these relationships to be generally assessed independently with a little bit of shrinkage towards the mean, because we are looking at a somewhat noisy proxy. So here are the nowcasting results. So now you can see I've brought the data up to the present using data from Nemesis that are about 1 week old. So what did the nowcasting results tell us? So we can see that there is a little bit of uncertainty from the model that I've built in here because, of course, this is just a proxy. It's not perfect, but we can see that it's very likely, based on what we're seeing in EMS data, that the black-white ratio, overdose death mortality ratio is unfortunately going to continue to rise, or actually has been continuing to rise. And this kind of just reflects the fact that overdose deaths appear to be continuing to go up for Black and Native communities and are pretty much flat or even slightly going down here for white patients. And now there's kind of finishing, I think there's also value in probabilistic forecasting. So this is saying not just bringing us to the current where there's some kind of information we can use to nowcast, but saying, should recent trends continue sort of into the future? What would we expect, right? This is something I think policymakers sometimes ask, like, in the absence of any big structural intervention, what do we expect to happen? And so to accomplish this, we used autoregressive integrated moving average models, or REMA models, for probabilistic forecasting. And so essentially each time series is treated independently and parameters are selected using a grid search and the AIC, basically to maximize model fit. And then the forecast, so I think there's two different forecasting models, right? There's the nowcasting model and this probabilistic forecasting model. And we could have ensembled them, but what we actually did is align them at the draw level. So we take 1,000 draws of the distribution of both models, of the predictions, and align them at the draw level so that we can propagate all the uncertainty from the nowcasting model into the forecasting model and then continue to have expanding uncertainty as we move from the present to the future. I think this model has some advantages in that it has a greater amount of input data. We only have EMS data for the past like 3 or 4 years, excuse me, whereas we actually have overdose death data for the past 20 years. So all of that temporal information about seasonality can go into the REMA model. But of course, the disadvantage is that we're just assuming that recent trends will continue into the future. We don't have any other kind of information about the future, of course, because it hasn't happened yet. So here is what the probabilistic forecasts look like. We can see now trends projected out through the end of 2020. And we can see, and I think this is just an extrapolation of things that have been occurring, right? But we can see that in the absence of a structural intervention, we expect the black-white overdose ratio to rise to 1.7 by the end of 2020, and the native-white overdose ratio to maintain at about 1.6. And there's really no expectation that trends will come down without some kind of intervention. And I think a lot of people were hoping like, okay, once, like there's that big spike in the early days of COVID, and hopefully as life returns more to normal in the US, overdose deaths will come down. But we're not seeing that in any pieces of these data, right? We're not seeing that in the provisional numbers for 2020, for the end of 2020. We're not seeing it in the in 2021. And we're not expecting that to happen in the next few years, unless we can, mobilize and do something about this public health problem. So future directions for this work, I think we're hoping to try a wider range of forecasting models and leveraging some ensemble approaches, and then also increasing the granularity of these forecasts to use monthly results and also state level trends. So very quickly, I'll just say that I think the data shown here clearly highlight that overdose mortality is increasingly a racial justice issue. In the media in recent years, it's really been painted as like a quote white problem, and I think that narrative has always been really problematic, but now is just patently false. And of course, there are deep-seated inequalities in access to medications for opioid use disorder, naloxone, harm reduction, healthcare, and all of these things must be addressed. Very importantly, incarceration has become much more lethal as a risk factor for overdose because of how potent and variably potent the drug supply is now with fentanyls and other synthetic analogs. And so combined with mass incarceration, I think fentanyl incarceration is really driving, I think, a lot of what we're seeing. And then I think finally surveillance should be updated to always include race and ethnicity information in provisional findings, because that data exists. They're simply not being prioritized to be put out in a timely fashion, and I think that should be changed. So with that, I'll finish. I'd like to thank my co-authors and mentors on this line of work, and thanks so much for your attention.